Well, hello there, everybody. I'm Nelson Weston, and y'all know what time it is. It's time for an all-new segment of Spotlight Carolina. Joining us today is our good friend, Dr. Ruth Thomson from Four Seasons, the care you trust. Dr. Thomson, good to have you on the show today.
Nice to be here. Thank you.
Nice to have you. Now, Doc, let's talk, because as you are more than well aware, your organization prides itself on the phrase, putting people first. But what does this mean, though, in the grand scheme of things?
Well, putting people first means that we will focus on your wishes and make sure that that is the core of the care that we are providing for you. So we'll work with you and your family to really learn what's important to you, and then we will make sure that that is what's most important to us. As a not-for-profit hospice, we're uniquely positioned to provide person-centered care.
Okay, I want to unpack that term, person-centered care. What exactly does that mean in the overall grand scheme of things as well? Yeah.
So person-centered care is individualized care that is really based on a person's preferences and their goals. So one of the things that we do first at Four Seasons is we'll try to learn who you are as a person, so that we can understand what your preferences, your values, your needs are, so that we can provide that to you in a way that you want to receive care.
Okay. Now, Doc, I want to take you back to something you said a few moments ago, nonprofit hospice care. Given your expertise on this, what are some of the main advantages and benefits of the aforementioned nonprofit hospice care, and why?
That's a really great question. So recently published data has shown that not-for-profit hospices provide 10% more nursing visits, 35% more social worker visits, and twice as many therapy visits as for-profits.
I see.
So that's really an important difference when we're talking about person-centered care. Additionally, an article was recently published in the Journal of the American Medical Association that was looking at how patient and family caregivers, experienced care in not-for-profit versus for-profit, and they certainly saw that they had a better care experience with not-for-profit hospice.
Very fascinating and insightful. Now, Doc, from what I understand, your organization covers 13 counties across Western North Carolina. Is that correct?
That is correct.
Okay. It does beg the fundamental question then, do these teams and providers that serve these individuals actually come from one of these communities and counties?
Absolutely they do. We have providers and we have care teams in all of our regions, so that we make sure that the care that's provided are from hometown people that know the area, know the community, and really care deeply about the community as well.
That is terrific. And Doc, very briefly, as somebody who's in this field now, what does this type of work mean for you?
Well, it's truly a privilege to be able to be invited into a person's kind of home and their family at a time that is really, incredibly challenging. And so it is just incredibly rewarding, and I can't imagine doing anything else.
All right. And for more information, you can visit fourseasonscare.org. Today's Spotlight Carolina was sponsored by Four Seasons.